one person there for a lot of hours, but at some point you reach a point where an individual can only do so much, and we always talk about you can actually manage probably, this doesn't apply to emergency medicine so much as acute medicine, which is the people that are admitted, but you can manage about 40 contacts a day by seeing people properly. So if you're saying that, and what we would like to have is every patient seen twice a day by a consultant, that means an individual consultant can only realistically look after around 20 to 25 patients, after which time there just isn't enough time to see these people properly. So it's when you expand your workforce, you start putting more people there, so you have 2 consultants on because your workflow has gone up. But you said we'll only have 1 consultant on, but you go for the 24 hours a day, and there is an element of playing one off against the other. My view is we need at some point to get to a scenario where there is a consultant available 24 hours a day, because it comes back to the business about 40-hour week. We accept that if you're ill at 1 o'clock in the morning, you won't meet a senior decision maker. And we accept that as a society. That's probably not good, especially if you're the person that's sick at 1.
Your second question about the North West London review that was commissioned by the NHS England London region. So that was commissioned, I think, prior to the Christmas period. We were requested to provide information data, activity data, much of the data that you've seen that we've provided, data that we're now putting on our website in terms of performance during that period, and we had provided that sort of information. It's not our review, we've contributed to it in the way that I've said, and my understanding, because it's been commissioned by the tripartite, so TDA Monitor and NHS England, and that will be going back to them for review and publication, and our understanding is that the findings will be put into the public domain. I can't genuinely say what that will look like or when, because I don't know. So I know we've contributed and we want to contribute because we see it as really important as a key part of the sector to understand why there's been challenges in the emergency pathway across the sector, and how from our part we can actually contribute to improving the things that we can influence.